Good evening. Welcome to this webinar from the Royal College of Surgeons of England on interview skills. Three of us in the room, and we're all going to introduce ourselves. Why don't we start with you, Kat?
Thanks. My name is Kathryn Ford. I'm a Paediatric Surgery Registrar training in the southeast of England, currently working at Great Ormond Street.
My name is Francesca Haarer and I'm a core trainee in my first year and working in the Kent, Surrey, Sussex deanery.
My name is John Brecknell and I'm a Consultant Neurosurgeon in Romford in the east side of London. So the first thing to say is you are very welcome to this event. We hope that over the next 60 minutes we give you some thoughts that might help with forthcoming interviews that you're taking part in for recruitment purposes. But we'll be particularly focusing on the arrangements for core surgical national recruitment. I think you have some learning objectives in front of you which formalise those aims. We want you to be able to describe the format of national recruitment, to have some idea of how to conduct yourself in a face-to-face professional interview in a way that's going to give you a favourable outcome in the process, and there'll be some helping thoughts about portfolio assembly. After this brief introduction, Francesca is going to take you through the structure of core surgical national recruitment, then back to me for some do's and don'ts about how to perform around the interview itself. And Kat will then take you through portfolio assembly. And hopefully there'll be at least 30 minutes at the end for questions and answers. So do feel free to put those into the system as we go along. Francesca.
Thank you. So I'm going to talk to you about specifically the interview process that you're going to go through as part of your application to core surgical national recruitment. And first, some key pointers to go through are preparation is absolutely key. The more you prepare, the better you will come across in your interview in each of the three stations. And I'll talk a little bit about those three stations in a minute. You need to be absolutely sure that all of your documents and your portfolio are ready before you go to the interview process. So the earlier that you can get those together, the better. On the day, obviously you'll be very nervous. You need to plan your transportation so that you can arrive with plenty of time to get to the Stuart House building and plan for example, any tube lines that may be down and other ways to get around that. You need to arrive early for your documentation check, and I would advise that you keep those specific documents separate to your portfolio so that you can hand them over with these. And you need to practice, practice and practice with as many people as possible, but specifically with a combination of your colleagues at your level and also some more senior colleagues. So going on to the interview process itself, as I've said, when you arrive, you'll have your documents checked. You'll need to have both your passport or driving license and a copy of that, as well as your GMC certificate, and that needs to be printed within the last week before you go to interview. And you need to have your portfolio, which is separate to your online portfolio, and we're going to talk a bit about that later. Then you will have your three different stations. There's a management station, a portfolio station, and a clinical station. And there will be a little break of 3 minutes in between these three stations. There will be helpers in the area and they will direct you to each station so that you won't be lost and you'll know which one to sit outside of. So in terms of the management station, you can see here the personal skills that they're going to be assessing you on, and they include judgment under pressure, how you communicate, your problem-solving skills, and your ability to act well within a team and also as a leader. In the portfolio station, they're assessing you on your achievements and on your surgical ability. And then in the clinical station, they're assessing you on your knowledge and capability and skills as a core surgical trainee and whether you are safe in the environment that you're being put into. So if we go into the three different stations, Each one lasts 10 minutes. The management station is split into 2 sections. In the first section, and as soon as you enter, you're given your 3-minute leadership presentation, and then you'll have 2 minutes question on that. And then you have a 5-minute scenario based on either leadership or management. In the portfolio station, there are 10 minutes, and they are specifically related to your portfolio and the checklist that you provide. And in the clinical station, there are 2 separate scenarios. One of them you are given outside of the station, and you have 3 minutes to read it, and then you answer over the next 5 minutes. And then one you're given in the station, both verbally, and there's some written documentation you can read as well. Then you'll have 5 minutes questioning on that second scenario. So in the management station, you give your speech over 3 minutes, and then you'll be asked a succession of questions where you'll have to think quickly and think on your feet. And if you prepare for these, you can have a good idea of what sort of questions that you're likely to be asked by the consultants. There are very common topics that then come up for the scenario part of the management station, and they often follow along the pillars of governance, pillars of clinical governance. There are then some surgical specific scenarios that are very common, things like the consenting process, targets, never events, the WHO checklist. These are all very common. Going on to your portfolio, the interviewers will have had a look at your portfolio beforehand, but you will need to be able to flick through to different areas in your portfolio easily, and they will need to be very clearly signposted. You'll then discuss with the consultants anything that is lacking in your portfolio in terms of evidence, or anything that they can't find easily. Lastly, you have your clinical scenario. As I said, there are 2 different scenarios, and these will be based upon common things. So common post-operative problems, common pre-operative scenarios, and also trauma scenarios. They encourage you to think quickly, and you should think through the scenario as if you're at work. Firstly, and always being sure that you're absolutely safe whenever you're talking about the clinical scenario ahead of you. And the examiners will try to pull you into the right direction. So I would advise be safe and be thorough when you're going through your history and examination, but also read the question specifically and try to make your answer relevant to the question that has been given to you.
Thank you. Back to me so soon. So how can you optimize your chances? What can you put in place to give you the best shot at conveying what you can and can't do in favourable light to the panel who are assessing you? You can start right at the beginning of the process, perhaps in advance of even making an application, by having a really good grasp of yourself and how that relates to what you're applying to do. What makes you tick? What do you like doing? What are you good at? What are your career plans? What specialty do you want to do? And do you know why? Have you thought about run-through training and where that sits in your application? Have you talked about being an academic? And of course, the point of going through this lengthy exercise of self-exploration is that if you can't convince yourself what it is you want to do, how will you convince the panel? There are many vehicles available for self-exploration, but there's a free one called Roads to Success, and a link to that publication is available on this slide. Portfolio collection is something that you can't do the night before the exam. You're going to be working on projects throughout your career. And every time that something is completed, every time you get an email of thanks, every time something comes up which you think you might be able to use in the future, put it in a safe place. If it's a bit of paper, put it in a folder with portfolio written on it. And if it's electronic, stick it in an electronic file with portfolio written on it. And then it'll be all in one place, nice and easy for you to put together just before the interview. Now, recruitment deadlines are real ones. They're not like the sort of deadlines that medical schools and foundation programs put on folk that seem to be infinitely stretchable. In the world of recruitment, a deadline is final, and if you miss one, you should expect that your application will not be accepted. You should make sure you know what the deadlines are for yourself and look them up in the available documentation. But these are the dates as I think apply to core surgical recruitment in this forthcoming round. In the immediate time before the interview, you can prepare yourself for it, and Francesca's helped you with a lot of this already. Plan in detail how you're going to get there. If you try and get there on the morning for an early event, are you going to be flustered? Is it better to spend a bit of extra cash and stay the night before? Have you been put on call the night before your interview? Can you swap out of that? Have you taken professional leave well in advance, or have you again left that to short notice? All of this thought is designed to make sure that when you pitch up, you are calm and fresh and ready to go. You can do a lot in your own head about working out what questions you're going to be asked. In national recruitment processes, those questions are often quite easy to work out from the available rubrics. But later on in life, why do you want the job? What can you offer your employer? Classic questions like this that always seem to come up. Practicing with colleagues is valuable, but don't forget how much you can do with a mirror or the video camera on your laptop. Watching how you appear to others is a very good way of improving your performance at interview. And regarding the presentation, of course you have to prepare it, but perhaps the thing to focus on as you practice is timing. Is it really going to run to 3 minutes, or are you going to be left hanging as they stop you before you've come to your conclusion? We're going to play a little game for the next few minutes, designed to showcase perhaps a bit of thinking on the spot, a bit of how to perform in an interview. So my colleagues are going to pick subjects and give me very short periods of time to prepare an answer and to deliver it.
So remaining in this scenario.
Remember that if you are asked to comment on scenario, you're asked to comment on just that scenario. Keep its specifics in mind and make sure that everything you say during that part of the interview refers to it.
Comfortable in your own skin, but not overconfident.
You don't want to appear cocky or arrogant or overconfident. That conveys impressions of a lack of safety, a lack of regard for teamwork. But you do want to be comfortable enough in your skin to have the confidence to perform. And there's a balance to be struck there.
Hello, and how are you?
A really good place to start. Hello, thank you for taking the time to interview me today. A professional greeting. Do be warned though that your panelists will have been instructed not to shake your hand.
Avoid duplication.
Don't say the same thing twice. If you have two scenarios, as you do in the clinical station in core surgical national recruitment, try and make sure that you don't deliver the same stuff twice. For example, don't talk through a complete resuscitation algorithm on 2 separate occasions. You won't score additional points.
Perfectly professional.
Everything you do needs to convey that you are the perfectly professional medical practitioner that you want to appear to be. So go out of your way to behave in exactly that way. Pick your favourite role model perhaps and emulate them for the proceeding.
If you really don't know.
I'm not sure I do know the best answer to this question, but you're always allowed to say you don't know once. It's probably better to move on to another line of inquiry than to waste time faking it.
Nod to the obvious, but don't go beyond it.
When answering questions, you can't assume that the panel know what you know, so you have to let them know that you know the obvious stuff. But if you spend the entire time dealing with the obvious, you won't get to the bits that score you the points around excellence and beyond.
interested in the process, the question and the panellists.
Don't appear bored. It's very easy to appear bored under pressure when you're trying to be calm, but remain interested in the process. Remain interested in the guys sitting on the other side of the table. The people who've given up their time to interview you are not being paid for it and will be quite nervous themselves. So knowing that you're interested in what they have to ask you goes a long way towards success.
Take a moment
to think, to put a structure on what you're going to say. It's well worth just taking a breath before going straight into it.
Goodbye and thank you.
Which is a great place to end. And we'll leave a positive memory of the previous 10 minutes with the panel as you leave the room. So afterwards, be ready to preference. Expect that email to come through to tell you what to do next. Take a few minutes to reflect on the experience of the day. Make notes, because you will be back at something similar, even if you find success on this occasion. And once you've got your job, do make sure you are able to receive and follow instructions for joining it. Kat.
Thank you. So for the final 10 minutes, we're going to talk specifically about the portfolio and the portfolio station. Many of you have had, or most of you, all of you will have had interviews before, but preparing and presenting a portfolio may be a new thing on this round. So the first thing to say, which I'm sure you're all aware, is the essential source for information and how to prepare the portfolio and what goes in it is available online via the application process. This is a screenshot from the first page, but it's a lengthy document and it's extremely thorough and does give you all information of what you need, including the self-assessment document, which you have to fill in at the time of application, and which of course you can't change before your interview itself. So the first thing to define in your own mind and to understand fully is what is a portfolio. So in order to explain that a bit more clearly, we've compared it to a CV, which again you all should have prepared and have one that's fairly up to date. So CV is something that's short, and it's essentially a summary of your qualifications, your professional history, and your personal details. And as you go higher up the career ladder, they get aligned to specific jobs that you're applying for. A portfolio, on the other hand, is more generic, it's more detailed, and it's the opportunity for you to showcase all your achievements, your competencies, the knowledge, your personal and professional skills. And for core, its main role really is to demonstrate your commitment to surgery and your career choice. And then clearly, as you take your portfolio and develop it for a specialty interview, it shows your commitment to your chosen surgical specialty of interest. Whenever we've run interview courses and things in the past, there are lots and lots of questions about what it physically should entail. The advice is that it's a single lever arch file. Some people go to one end of the spectrum and get them leather bound with gold embossed letters. It's clearly not essential, but something to take away is that it has to look professional and look smart. Secondarily is what to put inside it and how to organise it. So it's almost essential to have some form of separating device. So the simplest thing is to use file dividers. They're clearly labelled. And then you also need a way of flicking to specific pages for when you're asked questions and for identifying certain pieces of evidence. So one way of doing that is using tabs like post-it tabs, or making your own heavier device like using a paperclip. And I've got a couple of slides now on the content of your portfolio. So speaking generically first, as we've already alluded to, the development of the portfolio is a continuous process. And as you go about your daily life, attending courses and doing presentations, etc., you should have a way of, every time you've done it, filing that piece of evidence, whether it's electronic or in a physical paper form. In the portfolio itself, you need a very, very clear index, which should be ordered as per the checklist that you've already prepared for the interview guidance. And then I would advise also to have clear contents pages with summary tables of the evidence within that section, which means that therefore it's all logically laid out and very clear to the interviewer. The things that you also need to have in the portfolio, but probably separate at the front, is the interview form that you filled in, which they ask you to print out as a paper form, and also your CV. And the interviewers do look at that. So again, we've been advising in the past to have a couple of copies of that that's free within the folder so that the interviewers can access it straight away. Another thing to think about when you're preparing the portfolio is that everything you're doing is to complement the personal specification. So to think about what skills and what attributes the application process is looking for, and try and include that in the portfolio. And I've broken down the content of the portfolio here. This is not in the order of what the interview process suggests, but I thought these are important to focus on. The first is the logbook, which people use different forms, but probably most people are using the e-logbook at this stage of training. So you can print out a consolidated summary of your procedures, plus or minus any competency evidence you've got. And again, that forms in part of the e-portfolio as well, which again, you'll all be completing as part of your foundation training. And printing out various work-based assessments and proofs of competency is very useful for evidencing your commitment to surgery. It's also useful as part of that to print out training reports and things like 360s, or is that what you call them, the foundation? The 360 reports.
360 with the tab.
With the tabs are, again, they're not compulsory, but they're a really good way of evidencing the way you work and how well people grade you. Clearly, things like compliments and patient feedback are really important, and we'll speak about anonymising things later, but particularly the patient feedback, it's so important that it's completely free of any patient identifiable information. You need to evidence your engagement with clinical governance, and the key thing in that is audit and quality improvement, as well as your engagement with teaching, the learning you have attended to make you a good teacher, and also your leadership and management skills. There are sections for your publications and presentations, and we can answer more detailed questions about those later if you have any, but it's all very clearly laid out in the guide to the interview process. And finally, courses and conference attendance, which again, it doesn't have to be surgery specific, but part of the point of including this is to show to demonstrate your commitment to surgery. And finally, some important don'ts. Do not be tempted to bring more than one folder. Just bring one that's clear and well summarised. You don't have to bring a suitcase full of your PhD thesis, textbooks you've contributed to, etc. That they're not necessary and they will not be looked at. We cannot emphasise enough that you must have no patient identifiable information in your portfolio. Then that includes patient hospital ID numbers. So everything has to be completely anonymised. And finally, don't make claims without evidence. So it's difficult with the self-assessment because you want to give yourself as many points as possible, but it's a GMC issue and a probity issue if you overemphasize what you've done and then you cannot provide the evidence for it at the interview. I'd just like to talk about practicing for the portfolio station finally, which again is a bit what Francesca's already mentioned, but you need to be really familiar with your portfolio and the contents of it. So it's not a good idea to prepare it all the night before. It takes hours, if not days, to print everything and to organise it all. So you need it done at least a month in advance, and you can then organise meetings with peers and more senior colleagues, people who've done the interview before, ask them to look at your portfolio and ask them to ask you questions, and you can then show the evidence in it live as a surprise, which worked really well and will reduce your anxiety on the day when you attend the station. So that concludes our talking at you. We now move on to some Q&A questions.
So, question from me to you, if I can, Kat. As you practice with your portfolio, before an interview of this sort. Do you practice with it upside down? It strikes me that very often you have to access bits and bobs with it being presented to the panel on the other side of the table.
That's a very good point. And in fact, you're reminiscing about interviews. You end up yourself leaning over the table. So I think that's a really good suggestion. Definitely practice upside down. And it brings back to the other point of knowing your contents literally back to front upside down, because you can just find the tab you want and direct the interview to it without having to leaf through it.
And I think that's where the contents page is helpful as well. Yeah. The index at the front of every section, you can have a separate index showing where you score most highly and also highlighting the good parts of each of the sections, and that makes it a lot easier for the panel. You only have 10 minutes to score through your entire portfolio. Yeah. So it makes it much easier to do.
So thank you very much to all of you who contributed questions that we'll use to feed the discussion in the rest of this webinar. The first is from someone who says, I'm applying for both neurosurgery ST1 run-through and core surgical training. I'm just wondering if the panel could consider any neurosurgical based scenarios. We think that it would be going too far for us to try and specify the details of all of the various surgical recruitment processes that occur in the UK. But we did want to use this question as a way of pointing out that not all recruitment processes follow the structure that Francesca laid out for core surgery. Some of them have simulated technical exercises in them to demonstrate your ability to cope with three-dimensional tasks or simple tasks around stitching and tying knots. Others have simulated conversations down a telephone in a sort of emergency conversation mock-up, and others have stations involving talking to actors and actresses. As you prepare for each interview that you're approaching, you should take time to work out exactly what stations you're going to face. But to come back to the question itself, the panel interviews in neurosurgical recruitment are quite similar to those in core surgical training, but you won't be surprised to learn that the scenarios are all focused around neurosurgical environments, and being familiar with those is a good way of preparing for that exercise.
Talking about the panel as well, in each interview scenario, there are two consultants, but there may well be a lay person as well, and that person is not marking you directly, but you need to make sure not to be put off by that person who is simply looking at the interview scenario and making sure that it's fair. So do understand that there may be more than what you're expecting in terms of number of people in each interview.
Okay, so another question that has come already is, how much practice would you advise? And is there such a thing as over-practiced? I think we probably already slightly answered that in saying you need a lot of practice, and you can practice in many ways. On your own, videoing yourself and looking at it and critically appraising your own performance, as well as crucially preparing with other colleagues, both who are doing the interview and who have done the interview before. Personally, I don't think you can be over-practiced, but you have to make sure that your answers appear natural when you say them. So just delivering parrot-phrased, practiced answers does not come across well. You know, you're there as a human to convince the people on the other side of the table that you would be a good colleague. So you need to be professional, know your stuff, but don't come across as a robot.
Definitely. And practicing out loud, I think, is most important, because practicing in your mind is not the same as delivering it to two consultants sat very smartly across the table from you. And that can sometimes be a little bit intimidating.
Yeah. The next question is, do I need to do a taster if I've already had surgical experience? That's an interesting one. There's no, on the personal spec and on the inclusion criteria for your portfolio, the taster bit comes under your commitment to surgery, which is what gets marked on the day of the interview when the panelists look at the portfolio. So in a sense, it contributes to your commitment. It's not a prerequisite or a thing you need to get through the interview process. But if you haven't done lots of surgical placements, doing a taster shows that you've endeavoured to experience surgery and that you're interested in it.
I think the short answer to this question could just be no. There's a principle here about portfolio development and how to make sure that you don't have all your eggs in one basket. For example, if you have already done foundation jobs in a couple of surgical areas, taken some time after foundation to explore some more, adding a week as an observer into the portfolio contributes nothing to your score in that domain, perhaps. You might be better using the week to develop an area of your portfolio which is weaker. For example, if you've never done any management or weren't able to demonstrate that you had any skills in the leadership domain, why not spend that week shadowing a member of the executive team in your hospital? If you're weak on teaching, spend the week at the medical school contributing to the delivery of a class in some medical area, or shadow a research group, perhaps, if you've got nothing in the research and publication box. The principle being that if there's an area of complete void in your portfolio, you'll score a 0 there, and it's usually quite easy to add a bit to that by doing a little bit. Whereas if you're already capturing 90% of the marks in one area, getting that last 10% often takes a Herculean effort.
And going back to what Kat was saying, in the portfolio, there's a very clear system online that you can look at to say what evidence is suggested for each criteria. And the yellow ones are the ones that you're aiming for, but the purple ones also are marked, but you don't self-assess that. So it's important to provide evidence for those things as well, in whichever section that you need to place them into.
So next question is, does it give a bad impression to do a locum year prior to applying for surgical core training? And there's another comment here that's knowing that as a foundation trainee, one can rarely afford the fees for courses and exams or get the leave to attend them.
Do you think this is a question about the F3 year, perhaps?
Yeah.
A little bit?
Yeah.
You're closest to that, Francesca. What take do you have on that?
I think there are different parts to this question, and I think this person has clearly pointed out that a lot of the courses and the exams, especially for surgery in particular, are very expensive, and perhaps doing a year where you're paid small money as a locum can mean that you can afford more courses. But at the end of the day, if you look at your portfolio, there is one section on CPD courses, and there are other sections on different things. So it's not going to cost you any money to do any research or to write a paper or to do an audit. And these are all things that you can do, as well as the RCS does lots of different days that are free, and they have lots of advice as well for portfolios and mentors that can help you. So you don't necessarily need to spend in order to get through this interview process or to have a good portfolio. In terms of doing a locum year, I think it depends what you want to try and achieve during that year. If there's a particular part of research you want to do, and a professor in a very specialist area has asked for some help from you for that, I'm sure that would be an excellent idea and might add to your CV or your future or later career. And if there's a specialty you haven't experienced before that you'd like to try before you enter core training, I'm sure that's also a good idea. But I don't think it necessarily is a positive or a negative depending on what you've achieved for that. Certainly, if you go and lie on a beach for a year and you haven't added to your portfolio at all, I don't think that that will give you any extra marks.
I think there are two facts to throw into this, perhaps. The first is that 60% of foundation doctors who were F2s in the 2018 cohort chose not to go straight into training of any sort. And that means that if you're sitting there in a locum year, if you're sitting there in an F3 or F4 year of any sort, you are in the majority. And it would be hard for that practice, therefore, to create a bad impression. And the second is to pay particular attention to the exclusion criteria that exist in applications like core surgical national recruitment. You can do too much surgery after foundation and find yourself no longer eligible. Those criteria change periodically and are changed to the current rule, which is published in the person specification on the specialty recruitment pages of HEE, and is also linked to the Oriel application page, is likely to change before the next round of core recruitment.
The next question is, would it be more positive to have many awards, presentations, publications, or to have a good performance at the interview with a rather average CV? We were talking about this bit already, I think, in the having eggs in baskets. And clearly you want as strong a CV portfolio as possible whilst maintaining a reasonable quality of life and enjoying other things apart from work, which do exist. And you can have a really shiny portfolio but deliver a terrible interview and not get the job. And the vice versa is also true. So when we were talking about this question earlier, I think our consensus was that you need to perform well in both, and it's not one or the other. The interview process is relatively tick box, so that would be fair to say, I think. So it's very difficult to do really well versus really badly, I think, because as long as you've got the things in the CV and your portfolio and you're answering the questions according to the criteria, you will get through with a reasonable score.
And do you remember that each of the different stations count for the same number of marks? So you do need to spread yourself and your revision and preparation time across these 3 different stations, and remember to practice the management and leadership one as well as the portfolio one, because I think a lot of people practice the clinical one and perhaps forget a little bit about the others, because there is a lot of technical information you need to know about those stations. So as long as you're spreading yourself across the 3, then you should do very well.
The next question is about the clinical station, clinical scenarios, which we've touched on briefly. The question is, what would be the suggested format for answering the clinical station? This is related to the ABCD approach and then suggesting further management.
I had a take on this as we were discussing questions beforehand. There's a common theme in preparation for particularly core surgical national recruitment, which says that you must run through the ABCDE approach. But having sat on the other side of the table a fair few times in this process and others, I wanted to paint a picture of how dull it can be to hear the first 5 letters of the alphabet repeated quite so often and at such length. It's important that the panel know that you are good at resuscitating patients, but there's so much more to convey. What are the particular priorities of resuscitating the patient described in the scenario, the specific scenario which you've been asked to talk about? And if you can get that out of the way quite quickly, there are often very many other areas of potential discussion to have regarding the patient, what their differential diagnosis might be, how you might move towards definitive management, what that definitive management might be. And if you spend the entire 5 minutes resuscitating the patient, there's no time for those other things. I think it's a good question. So as I said in the tips and tricks, nod to it, Make sure they know that you know about resuscitation, but then move on and stay in the scenario. Stay to the specifics of the patient you're talking about.
I think that question is also pitched at being a core trainee and no longer a foundation doctor. So when you're answering the question, you do need to be thinking, do I need to involve my seniors, for example, my registrar, and then higher up my consultant? And do I need to be preparing this patient for theatre? And if I do, what things can I do at my level in the clinical scenario to make that then easier for your seniors when you're getting the patient ready to go for theatre, or when it's an unstable patient and you need to discuss with HDU or ITU. So do you think that this is a step ahead now when you are acting as a core trainee?
We're now moving on to some of the questions that you've been asking and submitting during this hour-long webinar. I think the last question is particularly, we discussed this with Francesca earlier, which is, for the management station presentation, is it better to talk about the clinical experience from the past, or discuss something outside of medicine and apply it clinically?
I think you can do both, and I think as long as you come across and present yourself well and professionally, and you show that you're a good leader within the scenario, I would say that it doesn't matter too much which scenario you pick, but also be mindful that many people are going through this interview process. So I think being unique and showing a situation which isn't your basic average situation might set you apart from the other people who've come to the interview, and perhaps make it a little less tedious for the people on the other side.
There's a generic here, perhaps, that if you have an example or a piece of evidence or a story from the specialty that you're targeting, use that. If you don't, and you have one from generic medical practice, use that. If you don't, and you have one from your wider personal life, use that. If you have something extraordinary, as you say, then for goodness sake, go straight to it. You know, if you've been part of a national squad or you've got an Olympic medal, don't worry if you don't, by the way.
But wow, if you
we have interviewed people that have over the years. So if there's something like that about you, you know, if you're the first person up the south face of a remote Andean mountain, or whatever it is that's extraordinary about you, don't forget to make the most of it. I don't know if that helps now that I've said it, but anyway. Why don't you pick one, Francesca? Read out the question.
So it says, one of the questions here is, how much proof do you need for conferences in the portfolio? And I presume that you are asking the question as in proof of attending a conference. And if so, you normally get a certificate of attendance whenever you attend a regional or a national conference. If you didn't get that, you can always speak to the organiser. They'll often resend a certificate if they've forgotten to send it to you, or you didn't manage to pick it up on the day. That should be proof. There's also proof that you have presented orally or as a poster, and that often comes within the programme itself. So if you can take a copy of the programme, highlighting your name and the presentation that you've done, that is evidence and proof that you have not only been at that conference, but presented in which particular manner. And I think that that's enough proof for attendees.
I have heard it said by panelists in portfolio stations that having your name in the programme as contributing to an article does not prove you were there. So I'd encourage you to put both of those two items in for your conference attendances.
Yeah, I'm sorry if I made that confusing, but have your proof that you've attended the conference, certificate of attendance, and also the programme with your highlighted name. Put everything in. So the second question here is there a preferred ordering layout of the portfolio? And that comes back to what Kat was saying. There's a very clear portfolio guidance online that you can get through the Oriel website. And it clearly states that at the front of your portfolio, you need to have the self-assessment checklist. You then need to put your CV as probably the second thing. And then there are the different sections within your portfolio, the audit, the research, the leadership, and the commitment to surgery. So I would lay it out exactly as the self-assessment criteria have shown you. And then that makes it much easier then for the examiners whose marking criteria, I presume, will follow the criteria in that order. So I would lay it out exactly like that.
Can I pick another one, please?
Yeah.
What makes a good leadership scenario, and what are they actually looking for? We haven't really talked about the specifics of what tends to be presented in that station, perhaps. What's our generic shared experience of that sort of event?
This is sort of, a lot of these are clinical. So I think, you may correct if I'm wrong, but this is the sort of question about perhaps a trainee, a colleague in difficulty, that sort of thing. So I kind of call these hot topics when I was studying for interviews. So it's that, it's the extra skills you need as someone working in an institution in a way. So they're not always patient related. So an example is a colleague's turning up late for work consistently, and they may have made a mistake or something. And I think a good format for answering that is to follow a template. So ensuring that patient safety is a priority. And then it's about exploring what's going on for your colleague, and taking initiative. So, offering support to them, trying to work out why they're late, if they've got a problem, are they struggling, and then escalating accordingly in order to provide the best support for that colleague. And there are many, many other examples. I got asked that specific one for core. What did you get asked?
I was asked a very similar scenario. So we gave a 3-minute leadership speech, as you all will do, and then we're asked 2 minutes about that leadership speech afterwards. And I think you can use many different scenarios to show that you've been a good leader, but you must have been the leader in that scenario. And it's helpful if you pick out good parts of being a leader and how you showed that you were a good leader. So I think you don't necessarily need to use a medical example. If you are giving an example answer, as long as you follow a logical system, and there are lots of different acronyms you can use, but one of them is STAR, so situation, task, action, result. If you go through those 3 things whenever you're giving an example, then it means that you won't miss any of the particular steps, and you'll be able to show what action you did that showed that you were a good leader.
The score sheets for these events are not just a blank box for panelists to write the odd number on. Panelists are given strict marking schemes with index phrases linked to certain scores, and those schemes are arranged around the person specification items. For example, where in your interview process are you going to convey your part in the multidisciplinary team? In a management scenario, for example, you might have the opportunity to acknowledge the important role of the porter or orderly in running somewhere with a form or a sample. You might be able to convey the fact that you understand that nurses and physiotherapists and occupational therapists and non-clinical management team members make essential parts of the structures that look after patients in elective and acute scenarios. And you may do the same sort of thing with other areas of the person's specification. So you can use these scenarios as vehicles for addressing all of the domains that are being examined in the process, and those in turn are specified in the person spec.
So there's one question here saying, any tips for medical students and how to prepare from this moment onwards? I think it's very good that you've listened to this talk already and you're thinking about your future career. If you look at the portfolio specification, that's probably the first thing you can start to work on, and you can start to extend your CV from there. So it's things like getting involved in audits and in quality improvement projects, looking, for example, when you can do a research project with one of your senior colleagues, taking on a role, a leadership role, so whether that's a local role either with a sports club or inside your hospital as an opportunity in terms of being representative for trainees. All of these things will add to your portfolio, and that means that you have a very rich portfolio when it comes to the interview process. You can also pick certain surgical jobs if you think that that's the type of specialty you want to do, and the more jobs that you do, the more varied your experience will be. I think that would all add to your preparation from medical student forwards.
I wonder if the medical student who wrote the question, presuming it was a medical student who did, might have decided that they want to be a surgeon, but they might not, and they might not have decided what sort of surgeon they want to be. I think one of the most important things for early medical learners is to make a grounded decision about what they want to do, and not despair if they seem unable to make that decision. Spend time finding out the reality of the career that you're about to choose. Romantic notions of what it is to be a surgeon, in this case, often come over quite poorly in face-to-face interviews, whereas the desire to pursue a career that you've thoroughly investigated in person conveys a maturity and a conviction which is much more valuable in terms of earning points. But don't wait to start building your portfolio until you've made that decision. Grab any opportunity to complete a project, to earn a mark of distinction, to take part in a committee or other event that will help you stand out, and collect those items as you go forward. They'll all score points at this stage, and the difference between a paper in renal medicine and a paper in renal transplantation at this stage of application is really paper thin.
And I just want to pick up on the last question on the slide, which is regarding the portfolio, should I only include evidence which specifically indicates the maximum number of points that's achievable in that section, or is it worth including additional evidence relevant to that section? Again, I get the panelists to agree or disagree, but I think you should include everything, because, but in a descending order, if that makes sense. So for something that's worth 8 points, say you've got more than 2 in the publication section, more than 2 publications where you're first author, clearly they go first, and then you descend down to the less highly scoring things, and that should all be indexed in the content section in that order within the portfolio. Because if you list it in a contents page, if it's not there, it doesn't exist. So you have to have evidence for everything. And I would definitely say it's worth including everything you've done.
Definitely, I completely agree with you. Include everything. And it's a very good idea to structure it in a way that you put your maximal points first, because that will again help the panelists doing their scoring.
If you only put your gold star item in, and the panel disagree that it's got a gold star, you could lose out.
Yeah.
And you'll have no further marks.
Yeah. But in the other direction, I think that a portfolio can be too bulging at the seams. You've already talked about not going into a second folder.
Yeah.
And some portfolios do seem to carry a bit of dead wood sometimes. For example, reproducing every workplace-based assessment you've done through Foundation is usually not ideal, and restricting that bit of your portfolio to the procedural assessments, for example, might be something to consider.
So there is a question here on how can I anonymised thank you cards. And I think that blanking out the name certainly is a good idea, but you absolutely cannot include any patient identifiable criteria, and that includes also the hospital number, date of birth, NHS number, anything like that. So I would make sure that they're completely blanked out.
But how to is an important part of the question, isn't it? And you've got some options. You might not want to deface your favourite ever gesture of gratitude from a patient that you invested time and effort with. And so taking a black marker pen to scrub things out might not fill you with joy. But don't rely on a piece of sticky paper over it, because it can fall off. And perhaps a halfway house is to photocopy the stick-itted document, or to use an electronic format for redacting the document that you're reproducing. The GMC are really hot on this, and when running national recruitment exercises, the organising panel are instructed to have post-interview discussions with anyone who's got anything like a hospital number or a name in their portfolio, and it will be taken off you before you leave the building, with a view to avoiding that falling into the public domain after you've left. So just don't put numbers and names. It's not worth it.
And I'm sure we've mentioned already, but that's also part of the e-logbook as well. When you print that out for your portfolio, make sure that when you've printed out the cumulative results of it, you take off any identifiable criteria,
including hospital numbers.
Including hospital numbers.
Yeah, the summary report, condensed report, doesn't have them on it. It just lists procedure and the number of times you've done it, and in what capacity. So that's the best format probably to print it out in.
Can you still score points before the interview, despite the application process having closed? I'm going to assume that this question is about the self-assessment exercise, and that can't be changed after the application's been finalised. But that doesn't mean that you can't put newer items into your portfolio on the day, and if they are better scoring items, they are likely to be recognised.
There's a question that says, does a failed attempt at the MRCS have any place in the portfolio as a way of showing investment or time and effort? I'm not sure I know the answer to that.
Well, there is an answer to this, actually, and that is that taking the MRCS demonstrates commitment to surgery. But of course, it doesn't convey as much success, dedication to study, etc., as passing it. So if you've taken the MRCS and been unsuccessful, I would include that in my portfolio, because I think it shows commitment to surgery. Indeed.
Yeah.
Time to wrap up. We want your help with future webinars. So if you're sitting there with great ideas about webinars that would fill you with joy and information, then do pass them on to the events team at the college. If you are not a member of this college and you wish to join us, then there are all sorts of ways you can get involved. And again, the college's website has information on that. And we have various social media platforms that you are very welcome to watch, follow, and use. Thank you very much for joining us this evening, and good night.